The health department says more children are testing positive for COVID-19. The news has left many parents concerned about the kids' exposure to the virus, especially as the world is trying to make sense of this new Omicron variant. So far, there have been no reports of many children being gravely ill, and some were admitted to hospital for other treatments when they were tested. Let's discuss this then with Professor Mignon McCulloch, the executive at the South African Peadiatric Association. Prof, a very good evening to you. Grateful for your time tonight. Are we any clearer on why we're seeing more children, especially in the under 5 category, testing positive in this wave?
Thank you very much for having me on your show again. And the question is a good one. We know that the Omicron virus is now alive and well, and specifically in the Gauteng area, but it is reaching out throughout the rest of the country. We're only 10 days into this new variant, so we knew about it on the 24th of November, and our scientists are working really hard to try and work out the characteristics of it. So what we know is that it has more variants, and we were concerned about that if we didn't get enough people vaccinated. We think it's more contagious. And incidentally, we are seeing that more children seem to be affected than previously, but it's still far less than the adults. So adults, still 80% of the patients are adults. The figures we now know, 19% are 0 to 9-year-olds and 11% are less than 2. Mm-hmm. But many of these children are being, as you said, admitted to hospital for other problems. So we sadly heard you say that there was a head-on collision, and so children are coming in with trauma or with other illnesses, and they are just happening to test as positive for this COVID variant. We communicate with our colleagues across the country. So as SAPA, we are the advocate for children, and so we've been chatting to our pediatric colleagues who are really great up in the Gauteng area. They've had 1 or 2 children who've needed to be ventilated, but on the whole, most of the children have not even needed oxygen. So mild illness at the moment, not very severe. Mm-hmm. On the adult side, we know that mostly the people that have been very ill are those that are unvaccinated and again over the age of 60, which is what we've been saying. But with this new variant, there does seem to be a younger group of people also being infected, and it really is early days for us to know what really is going on. But I think the message we need to get out there is vaccinate, vaccinate, and vaccinate, because this variant is just going to continue. You know, they say there are 31 or 32 mutations on it. It's going to continue to do that. We need to be smart. We need to wear masks. We need to hand sanitize. And this is not a conspiracy theory anymore. Everybody, I think, on this show knows somebody who's had significant COVID. And our healthcare workers are fatigued. They're tired. We now, yesterday, 10,000 new cases, so we are now officially into our 4th wave. We are concerned about children. We're very concerned about adults. Mm-hmm. And so the only way we're going to get on top of this is to actually vaccinate and encourage people. We are very lucky in South Africa that we've got a government who's gone and got us enough vaccines. Unlike the rest of Africa, only 6% of the rest of Africa has actually had the vaccine. We have the vaccine, but people are turning it down. And so if we're worried about our kids, which we are, and I'm sure a lot of parents are, that the message is please go out there and go and get yourself vaccinated, get your family vaccinated. Yeah.
The challenge, of course, with vaccination and children is that currently in South Africa, we don't have vaccines available for the under 12 age group. Yeah. So what then do parents do to try and protect their children? Do they just rely on the masks, the distancing, and the parents themselves being vaccinated in the home?
So that's the recommendation at the moment. We know in America the FDA has just approved the 5 to 12-year-olds, so we will in time get vaccine for the smaller children. But what we're trying to do is actually get all the adults vaccinated so that we can try and get 60-70% of our population vaccinated. Masks, absolutely. Sanitizing, yes, and not hanging around in groups indoors. And we've got summer, so if you're going to be celebrating the festive season, we would suggest being outdoors and not having large groups of people sitting indoors celebrating that Christmas lunch. Get out there and do it outside.
So some of the commentary around the Omicron variant has been that the symptoms are, in some cases, slightly different to what we were told to expect. I was listening to Dr. Angelique Tsier, who was saying the patients she's seen mainly complain about a bit of a headache, fatigue. For parents, what should they look out for in children?
So parents know when their children are not right. That's the first thing we teach all medical students. A parent knows when a child is not well. So if your child is more fatigued, if they're running a fever, if they're coughing, or they've lost their appetite, definitely something to think about. But we're seeing quite a lot of influenza virus as well. So if you are concerned, you need to go to a clinic, or you need to go to your GP or a healthcare provider. But I've also heard that the loss of smell may not be as prevalent with this new variant, but it's early days. As I said, it's 10 days into it, and our scientists are frantically trying to find out how this one behaves, what it does, and what it looks like.
What then is the advice for pregnant and lactating mothers who've not been vaccinated, for example? Is there a point where it is unsafe to vaccinate?
No, so SAPA has actually issued a statement that is very clear. This vaccine is very safe for pregnant and lactating mothers. Absolutely right. These ladies are definitely at risk. So if you're pregnant or you're breastfeeding, please go and get the vaccine.
I'm looking now, Prof, we're just getting the latest numbers on infections reported in the last 24 hours, 16,300 plus. 24 new COVID-19 related deaths. And yes, there's always a lag between infection and deaths, but looking at the numbers so far, we've not even gone past 30 fatalities recorded in a day. Is that a sign then at this early stage that perhaps Omicron is more transmissible but less severe?
So I'm going to be very cautious in my answer because I like to comment on facts, and we just don't have the facts yet. I would love to say that it is less fatal or less severe. It seems to be more transmissible. That much we know. And we're really going to keep our fingers crossed. But the deaths so far are, as I've said, older people, and specifically people who are not vaccinated. We have had people who have been vaccinated who've actually contracted this variant, but their symptoms are extremely mild, and hopefully the vaccine is protecting them. So my take-home message, guys, for everybody, just try and get everybody vaccinated, because even if you don't do it for yourself, you do it for your family, and if you're a parent, you're going to be doing it for your kids as well.
I was just reading now a message from a friend who's a parent who's asking about the course of treatment. We know there aren't COVID-19 specific meds. You basically get the usuals that you get if you're treating a flu, right? Is it the same for children, or will there be slight tweaks, do you think?
So it'll be the same for children. Obviously, the one thing we always look out for is the oxygen saturation. So that's the little machine that you measure how much oxygen is in your blood. So if you have got some chest involvement or lung involvement, that is something we look for. And one of the kids that was in the report from last night needed some oxygen, and 2 of the kids actually needed to be on a ventilator, on a breathing machine. But I think in children, loss of appetite, making sure that they get enough fluids, keeping that temperature down using paracetamol, those are what we call the supportive structures that we put in place.
Professor Mignon McCulloch with the South African Peadiatric Association. Grateful for your time tonight, ma'am. Thank you.
Thank you for having me. Great.